Namaskaram, greetings, khair makdam to all of you my dear friends. मैं डॉक्टर पद्मजा ऑब्स्टेट्रिशियन एंड गायनेकोलॉजिस्ट आज आपसे बात करने जा रही हूँ प्लानिंग ऑफ प्रेगनेंसी इन लेट 20s and early 30s. If we look back about a couple of decades, the average age of getting married was 24, 25, 26 years. Now, with the woman empowerment, with the female lib, most of the females going out and working, the age of marriage has gone up. These days, women start getting married around the age of, let us say, 28, 29, 30 years, and subsequently, since the later marriages are there, the planning for pregnancy is also delayed. Now, with something good, something bad normally comes up. So, there are certain disadvantages of getting married a little late. Now, we will be discussing what are these disadvantages and what we can do to rectify these problems and timely plan our pregnancy. See, the number of eggs in a female body are decided when a female is born, and once you start menstruating, every month you keep on losing one egg. So, by the time you reach the age of 28, 29, 30 years, your ovarian reserves are decreased. By decreasing ovarian reserve, I mean to say that the number of eggs in your ovaries are narrowed down. They are very, very lesser numbers. So, in case you want to get pregnant in that period of time, you really have to think and plan the pregnancy to have a successful and a viable pregnancy. Now, what can be your questions? Once you get married a little late, or otherwise also whenever you are planning a normal pregnancy for a younger person also, certain questions come in your mind once you get married. When should I plan my pregnancy? How should I proceed forward? What should I do to get pregnant? And what will be the ideal time for me to try to attain the pregnancy? Because everyone is working these days. There are lots of stress and pressures of job and performance also. Social taboos also in case you are not conceiving. So, the stress factors keeps on multiplying one after the other. These stress factors also have so many deterrent effect on your body. Now, so we will be discussing these issues one by one. Once you get married a little late and you are planning a pregnancy, there are certain things you need to know as a part of preconceptional counseling. You need to know your blood group, what is your Rh typing, in case you are Rh negative. By Rh negative means you must have heard blood group A positive, B positive, O negative, AB negative. So, in case you are blood type negative, it is mandatory that you get your husband's blood group also tested. In case both of you are negative, it's fine, nothing really to worry about. But in case you are negative and your husband is positive, you might require certain kinds of specialized investigations and certain vaccinations to prevent Rh immunization related complications in pregnancy. So, that was about your blood group. Then you need to discuss your genetics with your doctor. In case there is a family history of some diseases running in your family, if there are babies in your family who require blood transfusion, or there has been any history of deformed baby or another birth abnormalities, you ideally need to discuss these with your doctor prior to conceptions, because these days there are certain investigations which are done to rule out certain genetic abnormalities which are likely to run in families. A very simple example and a simple blood test is screening of thalassemia. These days thalassemia screening is widely available and it is a part of antenatal and as well as preconceptional premarital screening as well. Then you need to discuss your nutritional status, your health issues. There are people who are overweight The overweight or obesity can be because of diseases. A very common example is polycystic ovarian syndrome, which is a lifestyle kind of problem and it's coming up in a big way. Then people who are underweight really need to pick up weight. They need to be on good nutritious and balanced and high protein diet. So diet related issues are also to be discussed. Now there are certain screenings and vaccinations required these days. Of course, in India there are no mandatory protocols followed, but yes, abroad there are strict norms. These days in India also we have started following WHO norms. You should ideally get certain screening done for rubella, hepatitis B, tetanus, diphtheria, pertussis, varicella, and the seasonal flu vaccines are also available. Now, this was in relation to your medical history. Certain things which also need to be discussed are sexually transmitted infections. If you and your partner are suffering from any kind of sexual infections, it should be ideally treated prior to planning your conception. Now, next we come to certain lifestyle issues. If you are on alcohol, if you are addicted to smoking, if you have addiction of smoking in any other way, like your partner is smoking, then you might be also a passive smoker. So, smoking in any form, whether active smoking or passive smoking, both are equally harmful. So, no to alcohol, no to smoking, no to any kind of drugs. If you are on any kind of medication, let us say epilepsy, there are people who might be epileptic, may have been taking anti-epileptic drugs for a very long time. Once they are planning pregnancy, they should go to the doctor, they should discuss that they are planning pregnancy so that their drugs can be changed accordingly. These days, as a part of preconceptional counseling, we start folic acid supplementation. Folic acid supplementation is given both to husband and wife to have good quality of eggs and sperms, so that once the egg is fertilized, you have a very good embryo. The supplementation of folic acid in your everyday life leads to a healthy baby and reduces the chances of having birth defects to a large extent. So, in case you are planning, these things to be taken in account. Now, the timing of the cycle, when you are likely to have the maximum chances of conceiving the baby. In a normal 28-day cycle, the mid-cycle is the most fertile part of your fertile cycle. Immediately before the menstruation and immediately after menstruation, if you are in relationship, you will not conceive. So, ideal time is mid-cycle, but that is only applicable to a 28-day cycle. What if you have a smaller cycles or if you have a longer cycles? So, we calculate retrospectively from your date of your next expected menstruation. 2 weeks from your next expected menstruation is your date of ovulation. So, supposing you had your menstruation of 1st of March. So, if you have a 30-day cycle, you are expecting menstruation on 1st of April. So, you count back 14 days or 2 weeks, that comes to somewhere around 16th of March. So, 16th of March is going to be your date of ovulation. This is a presumptive date of ovulation. Now, to conceive successfully, you need to understand the life cycle of sperm and ovum. Ovum is alive for 24 hours. Sperms can go up to 3 to 4 days. So, there is a very small window period. So, around periovulatory period, you need to be in relationship every alternate day to have conception. So, dear, in case you are planning pregnancy, certain things you need to have in account, which were as follows. Now, after the age of 35 years, there are certain risk factors which are more likely to occur. You could be borderline hypertensive, you could be diabetic. After the age of 35 years, there is a risk factor of having certain issues like rise in blood pressure, you could be having borderline sugars. So, once even if you get pregnant, there are certain risk factors of developing gestational hypertension gestational diabetes, and certain genetic problems like Down syndromes etc. are very high. So, even if you get pregnant, you should regularly go to your doctor, get yourself screened. So, in nutshell, if I want to summarize, plan your pregnancy well, take folic acid supplementation, have a healthy diet, control your weight, discuss your medicinal plan with your doctor. You might require certain change in drugs, and plan your pregnancy according to your desire and stay happy. Keep the stresses away, and last but not the least, good luck to all of you.